The Transforming Care programme is about getting people with learning disabilities and autism out of hospitals and into the community. These are some of the most vulnerable people in our society. Many of them have spent long years in hospitals, and getting them into the community offers them a much better quality of life, greater independence, and the sort of life that hopefully most of the rest of us take for granted.
There's about 100 people, which are costing us about £14 million. And for the Staffordshire CCGs, at the beginning of this process, which was about 2 years ago, we had about 32 people that we needed to discharge. And of those, only 5 of those people are still in patient care.
What we inherited was a really challenging system that really needed a lot of work and attention. And with support of our provider network and the commitment of the TCP team, support from NHS England and the cooperation of everybody that we work with, we've really managed to transform care completely for these people.
So I think very early on we recognised that unless we got to know these people really, really well, we had no way of being able to stimulate a market and no way of being able to talk to providers about what it was we wanted, what was needed. So I think what we did do, we spent the first few months really starting to get to know people. The CTR process was really, really helpful. We really got to know individuals, their families, their histories, where they'd been, where they wanted to go. And I think we then started to talk to our providers more as team members, and it was less transactional and more relationship based.
I must say that the Transforming Care changed our way of working. More than a year ago, we were operating as a low sigma secure learning disability hospital. Now we are running our supporting living accommodation in Stoke-on-Trent. We decided to transition from secure services to non-secure services, and we went to talk to all commissioners. We created a new service model, and within these 3 months we managed to change.
We were already working on transition with one chap who'd been in hospital for 17 years or so, and I think the success has been down to the transition programmes and the collaborative working with the inpatient settings that, like everybody in this whole process, it's been very transparent. They've been very clear about what the person's needs are, very clear about what the risks are, and then it's down to the provider really to assess those risks and decide whether they can meet that person's needs.
We've got 6 individuals that we support that have come through Transforming Care, which I have to say, really pleased. I mean, there has been some challenges along the way, but they are all doing well and living independently. We have one gentleman in particular that has spent 42 years in a hospital setting, and he's doing fantastically well. He's really embracing his newfound independence. He's going out accessing the community all the time.
We had 2 ladies in particular who were in one of our hospitals who it was difficult to move them on because their bespoke needs were much higher on the agenda. But very much talking with commissioning team, independence of sort of the IST, and having their involvement, we finally found 2 bungalows, and although they were quite far apart, we managed to get a staffing team together to support the ladies for discharge. Absolutely wonderful day when that happened, and I remember getting a photograph from one of the ladies who'd actually been taken into the community. Yes, she was in her wheelchair, but she'd been taken to the hairdressers for the first time, and sending a photograph to the team and saying, look at what we've all achieved, that this lady now has a much higher quality of life. From there, we then went on to work closely together with personal health budgets and look very strongly from families who wanted us to provide the care in bungalows for Oakwood Gardens, which are 9 bungalows, and we have a resource flat.
A lot of the good things that we found, especially in Staffordshire, is the collaborative working we've had with both the CCG and with the community learning disability teams that we work with. We've really valued the new role that they've put in within Staffordshire, the lead forensic liaison nurse, and we found that to be a real help and a link between us and the CCG.
In terms of the inpatient unit, I never thought that we would get to 12-week admissions. Never thought we would. I don't think the staff thought that we would, and I remember the first day when I sat with the staff team and talking about what the new service model would look like and how we would be supporting people in and out, and how the community workers would come in. I had a glare in front of me of, we can't do that, that's not what we do, that's, how can that work? and the work was fantastic, and the difference that we made to people's lives, unbelievable.
I have continued to be frustrated throughout my 25-year career as to how long it's taken to bring about real, meaningful, effective change for people, so they're living ordinary lives with valued roles in their local communities and where they want to be. And the changes that I've seen as a result of the TCP programme really starting and getting going have been the biggest changes, I think, organisationally across the piece, not just for our trust, but with providers, with our relationships with the CCGs.
I really feel proud the achievements we have made and the lives we have transformed through this Transforming Care Partnership. Most of our patients are now having annual health checks, and we will continue to improve the lives of patients with learning disabilities and also autism.